Welcome back to the program. You're watching Focus on Africa. Let's cross over now to Malawi, where each year around 17,000 people are diagnosed with cancer. Up to now, patients have had to travel to Kenya or India for radiotherapy treatment when other interventions such as chemotherapy or surgery have not sufficed. But earlier this year, the country installed its first ever radiotherapy machine in a private clinic in Blantyre. And more are currently being put up in a public hospital in the capital, bringing a ray of hope to patients who could not afford to seek treatment abroad. Ashley Lime tells us more.
Dorothy had a high-risk pregnancy. She had a cervical cancer diagnosis while 13 weeks pregnant. There were just two options: terminate the pregnancy to make way for surgery or start chemotherapy until the baby is born. But after having her baby, doctors told Dorothy some cancer cells still remained. Without a radiotherapy machine in Malawi, she had no choice but to travel to Kenya for life-saving treatment organized by Doctors Without Borders.
I had my fears when I was about to travel, especially leaving my 3-month-old baby behind to go to Kenya. But because I was going for crucial treatment, I had to encourage myself.
Dorothy's struggle is familiar to thousands of Malawians. For years, cancer patients relied on chemotherapy and surgery alone. Those needing radiotherapy had no choice but to seek treatment in Kenya or India. But in March, this changed. Malawi installed its first ever radiotherapy machine at a private facility in Blantyre.
I'm so happy that the radiotherapy machine we had to travel to Kenya for is now here in Malawi. Many with no options and no hope have died because they could not afford to travel to Kenya for treatment like I did.
With nearly 17,000 cancer cases annually, 75% of patients need radiotherapy. For these people, having a radiotherapy machine at home could be life-saving.
Investment in radiotherapy has always been in the plan, but its implementation has taken some time. We might say it might be sufficient, but it will not be only for cervical cancer patients. There are other cancers, breast cancer, skin cancers, which all require radiotherapy. So if we look at the scale of Malawi and the burden of cancer, there is still need for investing in radiotherapy.
The radiotherapy machines could save the lives of some of the over 2,000 women who die of cervical cancer each year in Malawi alone. But sub-Saharan Africa has the highest incidence of cervical cancer in the world.
Now we have the treatment machine here at home, so the cost of traveling abroad will be minimized. People will not have to go through the phase of worry like I did, worried about family, worried about children. Everything will be possible right here at home in Malawi.
While health officials here welcome the new radiotherapy machines, many now advise women to go for screening and say girls should get the HPV vaccination as a precaution. Ashley Lime, BBC, Blantyre, Malawi.